Dr. Southwell-Keely here, and I'll be explaining the deep plane facelift. Now, there are many different types of facelift. In fact, facelift is just a general term. It describes a rejuvenating operation for the face. But the key is to walk through your concerns with your surgeon, and then your surgeon and you will devise the facelift operation that best suits you and addresses the issues that you have. Now, a deep plane facelift is a modern variation of a multitude of different procedures, but it is a fantastic operation for rejuvenating the face. As we age, the soft tissue under the skin, that's the fatty tissues that gives our faces its shape and form, the contours, descends. And as it descends, we get a squaring off of the face and a blunting of the jawline, that transition from the lower portion of the face into the neck. The deep plane facelift involves elevating the skin off the face and then, more importantly, the soft tissue beneath the skin and repositioning it where it once was in your youth. Looking now at the before surgery photo of a patient who's presented for deep plane facelift, you can see the telltale signs of facial aging. There is a reduction in the volume of soft tissue or fatty tissue over the cheekbones and an emerging heaviness of that soft tissue along the jawline. And as that soft tissue has descended, you end up with a blunting of the jawline, the emergence of the jowls at the front of that jawline, and a redundancy or an excess of neck skin with the emergence of the muscular bands within the neck. You also notice there's a deepening of the nasolabial folds or the smile folds that exist between the sides of your nose and the sides of your mouth. If we now turn to the post-operative view of the same patient, you see that there's been a general rejuvenation of the face in a very natural way. There's been a return of that volume from the jawline. That soft tissue's been resuspended along the cheekbones, giving that beautiful high cheekbone appearance of youth. The jawline has been re-established and looks nice and defined, as too does the neck. That excess skin and the muscular bands have been removed, producing a lovely natural neck. There's an absence of jowls along the jaw, and the deep nasolabial folds have been effaced or made look less deep. Now, the operation itself involves a general anaesthetic and takes somewhere between 2 to 6 hours. The recovery is not terrible. It's actually not a painful operation. There is some swelling for about 1 to 2 days, and then that subsides in the subsequent post-operative period. It's not a particularly painful operation. You see me in the office at about the 5 to 7 day mark for wound review and to remove any sutures that need to be removed. After that, you're pretty good to reintegrate into your everyday life about 10 to 14 days after the surgery. Now, if you're entertaining the concept of a deep plane facelift for yourself, then please see a qualified surgeon. Qualified surgeon is a plastic surgeon trained through the Royal Australasian College of Surgeons and affiliated with the Australian Society of Plastic Surgeons. If you'd like to see me, please reach out to my office and contact my practice manager to make an appointment. I look forward to seeing you then. Bye for now.